So, Dr. Ali, we learned that you did a survey on pain. What was the need for that survey?
So in January of this year, 2019, we carried out a survey. It was a national survey of amongst all residency training programs on the level and quality of pain management, didactics, supervision, and exposure that resident psychiatrists do get throughout their residency training for the management of chronic pain. Chronic pain is quite prevalent. About 100 million people suffer from chronic pain just within the United States. The global burden for chronic pain is quite high as well. And there is an associated linked opioid epidemic. Primarily pain seems to be managed by neurology, anesthesia, palliative care, and primary care physicians. We're of the opinion that psychiatrists actually do have a role in this as well, especially considering many of the psychiatric illness have comorbid chronic pain.
So you did a survey. What did you find in the survey?
So our findings were interesting. There are about 221 psychiatry residency training programs, and we emailed all of them about 11 questions. It was a Likert scale, and we had a response rate of about 50%. Predominantly, there is a very few hours dedicated for didactics or clinical supervision or exposure to chronic pain. There are about between 21 to 25% programs that had no supervision for managing chronic pain. There are about 5 to 15% of programs that did have good quality, and they did put emphasis on pain management for psychiatric residents, but they're very few.
Did anything surprise you in terms of finding?
Yes, we did anticipate sort of that there is this dearth of education regarding pain management, but we had to study it from a scientific perspective and do this inquiry. So in a way, our fears did come true, and part of it was surprising as well. But what was surprising was for sure that even though there's about 73% of the respondents did say that they want to increase and invest in residence education, particularly regarding pain didactics. However, very few had the resources available, not just financial resources, but manpower resources in the form of trained faculty to teach residents of how to manage chronic pain.
So you have been a strong advocate for the people who suffer from chronic pain. Yeah. What do you think what are the future directions?
I think as a first step, it's to identify if there is a problem and to sort of understand the magnitude of that problem. Once we recognize that problem, only then we can make steps to fix it. As starters, I think psychiatrists themselves need to understand that they do have a role in treating and managing chronic pain, not just as sole physicians, but in collaboration with neurology, with family care physicians, with palliative care. And why I say this is because we have certain tools like psychotherapy, like mindfulness techniques, that we can use as adjuncts to not bring their pain to those suffering from pain to zero, but establish healthier coping mechanisms and even actually reduce their pain or minimize them to whatever extent that is.
I know that when the people suffer from chronic pain, they don't think about psychiatrists. So can you tell us a little bit more what role can psychiatrists play?
So I think the education should be at two levels. First and foremost is amongst ourselves within the field of psychiatry, and then also outside of psychiatry to better highlight and delineate the roles that we're going to assume here. But also with our patients, psychiatrists in general shy away from managing pain. And rightly so, because they're not as trained. When we're not comfortable with managing something, we are definitely going to shy away from that. So I think on our part, we need to be more eager, and then educating our patients too about what their sources of pain might be, and that even though we can't take away all of their pain, but we can work towards minimizing it and help them adopt better coping mechanisms.
Certainly. I believe that our patients, they suffer from chronic pain. There's a huge comorbidity of psychiatric illness and chronic pain.
Especially in substance use as well, yes, which often adversely affects pain treatment.
And I believe that your step is towards the right direction, and we should go that way.
A fellowship in pain management is a part of the American Board of Psychiatry and Neurology. It's a recognized fellowship, not very well known amongst psychiatrists. So I would encourage psychiatrists to sort of explore what the pain management fellowship is about, and it's actually very educational, and it's upcoming, and we foresee it in the future as the demand for psychiatrists who are willing, the demand for psychiatrists to treat chronic pain is going to rise. So it's a thing to come, and I think psychiatrists need to take that seriously and consider it.